treat me, you have to know who I am. I identify as the Latina lesbian mother.
To treat me, you have to know who I am. I identify as a transgender man.
To treat me, you have to know who I am. I identify as a gay man. I was diagnosed with anal cancer, and when I'm dealing with something medical, it's extremely important that they know who I am. Every doctor I've been to, and there were 7, all of the nurses, all of the assistants, everyone treated me with respect.
It is as important to know somebody's sexual orientation, and even more than that, what their sexual scenario is, as it is to know if they're getting a good night's sleep, or if they have a good appetite, or if their bowel movements are normal. It's all part of basic bodily functions that are required for a maximum quality of life.
It's important to have an open and honest relationship with your patient. And so if you do not know what their sexual orientation is or how they identify, that patient is not going to feel safe telling you everything that they need to tell you for their proper medical care.
Knowing a patient's gender identity and sexual orientation helps a practitioner to care appropriately for that patient. We see a lot of patients come in who may not be comfortable disclosing that information, and routine testing or screening may be missed for that patient.
When I was about 15 years old, I remember going into the doctor's office, and my doctor was very warm and very welcoming. She was asking me all the questions that she's supposed to ask to an adolescent, and I remember telling her when she asked about my sexual activity if I use condoms or anything like that, and I said, no, I'm gay. And I just remember her face changed very much, and her warm tone of voice turned very harsh, and it seemed as though she was rushing me out as quickly as possible.
As a lesbian, unfortunately, when I've been involved with the healthcare system, it's usually hasn't been very welcoming. It's usually assumed that I'm heterosexual, and so the questions go along that line, asking me about the need for birth control. And then I fill out forms that ask me if I'm married, single, divorced, or widowed. And none of those boxes apply to me.
I think it's very important to know that what people write on forms does not represent necessarily their reality, and it does not take the place of a provider opening the door to ask questions.
And you need to ask those questions in an open and thoughtful and caring way.
Many times the patient or client want to talk about their sexual health, but fear that they would be discriminated against or stigmatized.
There are a lot of ways that a provider could ask me questions that would make it more likely for me to disclose the fact that I'm gay than not. So I'd rather them ask me if I am in a significant relationship, if I have a partner. And then I'd like them, when they talk about other issues, to not make an assumption that because I'm gay I don't want to talk about having kids, or that I don't want to talk about relationship issues.
My partner and I and our children were on a family vacation, and my older daughter became sick. She got stomach pains, and we had to go to the local emergency room. And we get to the hospital, and they asked who was my daughter's parents, and I said, well, she has 2 moms. And they were like, well, she can't have two moms, only one of you can go in. My daughter was traumatized by that. We were traumatized by that.
It's not about sensitivity, it's about respect, it's about humanitarian response to a human being in general.
My partner was hospitalized recently, very severe aortic aneurysm. When he was being moved from intensive care to a hospital bed, the nurse in charge would not let me accompany him. I asked if I would have been allowed to accompany him if I were part of his family, and she looked the other way.
What needs to happen when a patient is admitted to a hospital is that the care providers think about the fact that the patient might have different sexual orientation or different gender identity than the care provider.
Throughout my pregnancy, I was very much genderqueer, and I did tell them about my pronouns, which ones I preferred, that I preferred gender neutral or masculine pronouns. But the people who were dealing with me throughout my pregnancy, primarily my midwife and the nurses associated with them, were not responsive to my identity and didn't actually respect it. Certainly I felt that my healthcare has been impacted. I feel less genuinely listened to, and I feel like there's a huge discrepancy between the care I get versus other people who have gone to the same provider and report a very different experience.
You need to empathize with the patient you're talking to. Give them an understanding that you care to understand who they are. That's all you need to do. You don't have to use the right words. Just be open to being educated on what right words to use and care.
I just transitioned about 4 years ago to start living as a man. When I was diagnosed with breast cancer, I found that my breast surgeon was unable to call me, even to give me my biopsy results. He did tell me very frankly and overtly that he had problems with my transgender status. And upon meeting me and learning of my transgender status, he decided that his first impulse was to refer me to psychiatry.
I used to work at a health center that did a lot of care for transgender patients, and there was a lot of discrimination towards those patients. There was a discomfort in talking to them. I myself had some discomfort because I didn't have much training on how to work with transgender patients.
The other day, a patient came into the office and his insurance cards identified him as Adam, although he signed the register as Emily. After being called multiple times by his birth name, he left the office.
I do think the LGBT community has special needs. I think the LGBT community has a specific special need, which is to be treated the way non-LGBT people have been treated forever, which is to be asked about their sexuality, to be asked about their quality of life, what their home situation is, what their work situation is, what their friend situation is, without the person asking the questions being afraid of what the answers might be.
Recognizing the differences of human beings and being able to address the issues and not using one ruler to measure someone else's existence or purpose in life.
My greatest hope for LGBT patients in the healthcare system is that when they go for treatment, whoever they're going to see accepts them for who they are.
Then having the people that we choose to be our families be accepted, to have them be a part of the healing process.
And the healthcare system can take care of us just like anybody else so that we can keep ourselves well and get the information that we need.
To treat me, you have to know who I am. I identify as a lesbian.
To treat me, you have to know who I am. I identify as a genderqueer, biracial, Latino parent.
To treat me, you have to know who I am, and I identify as a lesbian.
Our lives depend on your capacity to care.